Hey everyone, thanks for joining us for our weekly update. I'm here in Concord at the center of the Contra Costa Fire District, their administrative headquarters and their training facility on Treat and Oak Grove. Had a lot of history here when I was a member of the Board of Supervisors, in the legislature, helping with legislation, and now in Congress. And I just respect these folks so much. Every day when somebody dials 911, this is the apparatus that shows up in amazing time with the best trained people in the world to save your lives and help you. And so it's really remarkable to be here in the community in these stressful times, seeing these first responders who are just the best of the best and hearing their stories and being able to support them. We've also been out in the community this week at the Contra Costa Regional Center, the county hospital, of which I'm very proud of. My role in building that, being the deciding vote to build it, I was in the emergency room, meeting with the people there, and I did a video specifically outside that about what they're going through and what we're fighting for in the Congress right now to make their lives better and not destroy a really good business model. So it was wonderful to be there. Went to Berkeley to meet with people at the Food Institute there, another wonderful partnership that I've been involved with sometimes, a former restaurant owner, where the ag school, the resources school, the public health school, and the law school all work together to look at how we produce food that is healthy for people and manage to get that. And it has an impact on my work on the Educational Labor Committee, because a big part of this is how we get free and reduced federal meals to kids in schools so that they get the right food and they get in the right practice of getting healthy food and enjoying it and understanding how important it is, which goes back to why we're out. So I voted no against the bill that went over to the Senate. It passed out of the House because the Republicans had enough votes. It went to the Senate where it requires 60 votes, so 8 Democrats to vote, and apparently they couldn't count. Or they thought, with the president, we'll just ram this down their throat. So their big ugly bill eliminated health care for 18 million Americans who would no longer get Medicaid. And it had a ripple effect for Medicare and for private pay. And then in addition to that, it hurt the SNAP program, which is a very successful program to get nutritional food to people who need it, so that they can get to work and take care of their family. Sort of a basic element. It's been researched, bipartisan, good return on investment. And now, on top of that, in this bill that I voted against and I'm standing for, and we have to have a compromise, because we know your rates are going to go up if you have private insurance and employer-employee insurance, private insurance. Your rates are going to go up as much as a third because we're dropping the subsidies that have worked really well. Yes, they're subsidies, but the research shows they pay for themselves and more in terms of overall public health and keeping people out of the emergency room. So for years in Contra Costa, we've been a national model of making sure that on a physical level, we get health care before you get sick. And it saves everybody money, and it's a healthier model. So now this new model is going to get everybody sicker and put everybody in the emergency room, because you won't go to your primary care doctor. You won't be as aware of the lifestyle important things about not smoking, not drinking, and eating good food, quality food. All of that's worked. And now we're going to a model that doesn't work on any level for people's health, and probably most astonishingly, for the physical health of this country. So if you wonder why we're holding out, that's why. Let's work with the Republicans. They need our votes in the Senate. And let's come up with something that's for the best interest of Americans, which requires compromise by all of us. I get it, but you can't compromise when you've got a gun to the head of the American public's health and the physical stability of the United States. And one last thing, in the bill that they passed on the big ugly bill, Republicans supposedly care about fiscal responsibility. CBO, Congressional Budget Office, nonpartisan, well respected, said that that action would add $3.7 trillion to the debt and the deficit in this country that our kids will have to pay, and we will all pay in higher interest rates to finance that. So that's why we're out. It's important. When we go back in a few days, I'll be working with my Republican colleagues and others to say, let's get to a point where we reopen government and start working for everybody's benefit. I'm willing to compromise, but not this extreme where you've got a gun to your head and it's perfect madness. Feel free to call us or contact us if you have any questions. And as always, we're here to serve you and work for you, whether you agree with us or not.